Okay, so very, very briefly, myself and Amar are going to talk you through what's coming up next for the QI programme. So, in our view, there are three things that we want to talk about. The first is our new trust-wide QI priorities. The second is how we're trying to build a bit more of a balanced quality management system. And finally, how we're going to be creating a stronger learning system. So to talk you through the first two, here's Amar.
When we started with quality improvement in 2014, we gave most of our teams very free rein to pick things that they wanted to work on, whatever mattered really to the team and their service users, the population they were looking after. And that was really important. It was intentional. It helped people really give this a go and engage with it and try it. Obviously, the risk with that is that you have 1,000 flowers blooming and not really heading in a common direction. Within the first year of the work, we started to align the projects to two really large strategic priorities around reducing harm and right care, right place, right time. We started to see where there were a number of projects working on a common theme, and we started to bring them together into learning systems. So we had four big priority areas of work, from violence reduction, pressure ulcers, physical health and access, and we've seen the power of bringing teams together with a robust learning system already today. Our next move is going to be to think about more strategic priorities as an organization and using improvement to work towards that. We're going to be continuing the work on violence reduction and scaling that up. We're going to be continuing the work on improving access and flow through our community services. But there's going to be three new areas of work. One is around improving value for money, thinking about how we can remove waste and do things differently. The second is about how we can increase and enhance the experience of people who work in the organization, helping them enjoy their work a bit more and trying new ways of working together. And the third, which is a really exciting one, is to rethink what a recovery-focused community service would look like. And we've already started some of that prototyping in the Isle of Dogs and Tower Hamlets. Most of the improvement work we're going to keep doing is going to be team-focused. All of our care is delivered in teams, and that's not going to change. And all of our improvement work is mostly going to be done within teams. And that will align with priorities set locally by our directorates. But there is going to be now a slightly more strategic level of improvement work as well, obviously with some local testing. And we'll see how that plays out over the next year. The second big area for us to think about moving towards over the next year or two is going to be how do we bring all of these elements of quality together into a balanced and more holistic approach to quality. I mean, at ELFT, we see that there are many things we can do and are already doing to improve quality, not all of which are quality improvement. So we see there being four different types of activity that we all do all the time, in different extent, depending on your role. But there is a planning cycle where we think about what the needs of the population are, what the needs of our service users or customers are, and think about how best to meet those using the evidence base, and then design a service and put in place the structures and processes to deliver high-quality care. That's still important to us. We have control systems in place where we monitor how the system's performing, and we take corrective action when we need to. We use assurance intermittently to check that we are where we think we ought to be, and audit or inspection is a good example of how we use assurance. And we now have improvement, where we've had 3 years of experience now and knowledge of how to use improvement, where we take a complex quality issue that really matters to our service users or our staff, design a project and a strategy to help meet those, and test and discover better ways of delivering care. So our challenge really is going to be thinking about how do we bring these four elements together in a way that allows them to play together more effectively. And we'll start to see how we use planning in a little bit more deliberate way, start to build control systems, not just at the top of the organization, but at the very front line, so we can keep an eye on how systems are performing. We're going to use improvement in bursts of effort to take performance to a new level and see if we can sustain that. And then we're going to, when we finish improvement work, go back to an internal control system to maintain the gains. And that's how Duran, first of all, described the use of quality in his trilogy. And that's sort of what we need to now get towards, how we bring all these elements together. And obviously take the learning from a new designed system back into how we plan and deliver services. So the first part of this is to think deliberately about planning. How would we plan for improvement effort? And all of our directorates are now going through a planning cycle where they are thinking what really matters, How would we know what really matters? How could we discover that and listen about what really matters to people? How would we define our priorities based on that? Could we then design our projects to tackle those things and then use the year and the training and the skill development to help deliver work across the year? So those are the first two. James will talk us through the third of our big changes.
So let's talk about how we go about creating a stronger learning system. So before we even do that, I mean, what does a learning system help us do? So in my mind, I think there are three functions. And the first one is it helps us understand what current performance is. So just like Amar was showing you, we need to be able to visualize it and see if something's there, if it's good, is it bad, is it getting worse, is it getting better, but it allows us to see if things are where they need to be. The second thing it allows us to do is introduce change and see what is, but also what isn't working. So we've got the model for improvement, our methodology, we've got ways of training people, we've got QI Life to help us do that. And then I guess the final one, which is really important, is when we know stuff is working, let's scale it up. Let's share it across the organisation, which is really, really important. So here's a challenge. The bigger we become, actually, the more difficult that becomes. And as you know, for those of you who've been finding brand new ways to solve problems, it's timely as well, isn't it? It takes a lot of time and effort to find what works. What we don't want to be doing is reinventing the wheel when it's already working very, very well in other parts of the organisation. So it's how we learn from each other about what's working and what's not working, so we can take those ideas and move forward. This is my best go at what I think our learning structure is, and it kind of varies depending on whether you've just got a normal QI project or a high priority QI project. But we have things in place like the infrastructure of coaches, sponsors, QI forums, the program board. We've got some communications, haven't we? Like newsletters, the microsite that you've heard about. There's all the stuff we talked to you about, the training that we do, all those different offerings of training, as well as the improvement methodology. And for those projects that are in high priority areas, such as violence or access, they've also got access to small collaboratives where they come together as well. So I think over the next year, what we really need to be doing is using those resources probably a little bit more carefully. So for example, every time somebody starts a new project, how can we really harness the knowledge we've already got? How can we link people into the ideas that are being tested? And more importantly, how do we get people to introduce each other? Somebody in Bedson Newton who solved something, let's get them speaking to somebody in East London. Our training is a fantastic opportunity when people come together. So how can we make better use of what we already know and help people and guide people with that stuff? You've heard so much from people participation and service users, but I still think there's even more we could do to strengthen those links. And you can see how powerful that has been today. I mean, it's truly unbelievable. And so I'm so proud of that. And finally, segmenting communication. So if we are working with, say, community services, how can we get more comms just for community services rather than trust-wide? So there are 4 key points.